Salam sejahtera, sir. My name is Cornelia Yoshinin. Today I'm going to present is medical cover. Next, my main sport is basketball. As we can know that basketball is very popular all around the world. There have some pictures that is the famous basketball players in National Basketball Association, which is called NBA. At the first picture there, they have the logo of NBA, and the second and third picture is the famous basketball players in NBA. And then they have some my previous basketball game photos. Next, at the previous slide that I have talked about basketball, and then what is basketball? Okay, basketball is a team sport where two teams, usually consisting of 5 players, on each team play against other on a rectangular court. The objective is to get the orange and bouncy ball through a hoop mounted high on a backboard on the opponent's side of the court, while preventing the opponent from shooting it into your team's hoop. Next, what is the common injuries in basketball? There are 4 common injuries in basketball, which is ankle sprain, knee injury, finger jam, and deep thigh bruise. For ankle sprain, treatment for ankle sprain involves rest, ice, compress, and elevation. RICE, rise. The next for X-ray and evaluation by a physician is determined on a case-by-case basis and depends on the severity and location of pain. Pain and swelling over the bone itself may need further evaluation. An injury to the ankle is a child who is still growing could represent a simple sprain or could be the result of an injury to the growth plates located around the ankle and should be evaluated by a physician. And then they have a Giffy is talking about how to get an ankle sprain when in the competition. Next is the demo video how to bandage an ankle sprain. Next is knee injury. Basketball requires extensive stop and go and cutting maneuvers which can put the ligaments and menisci of the knee at risk. Injury to the medial collateral ligament is most common following a blow to the outside of the knee and can be often to be treated with ice, bracing, and a gradual return to activity. An injury to the anterior cruciate ligament is a more serious injury and can occur with an abrupt change in direction and landing for the jump. Although this ligament tear is most commonly a season-ending injury that requires corrective surgery, current techniques used to repair the ACL ligaments generally allow the players to return to play the following seasons. And then they have a Giffy that is talk about the knee injury. Next is the demo video that how to bandage the knee injury person. For finger jam finger occur when the ball contacts the end of the finger and causes significant swelling of a single joint. Application of ice and body tapping the finger to the adjacent finger may provide some relief and allow the athlete to return to play. If pain and swelling persist, evaluation by a physician or athletic trainer is recommended and an X-ray of the finger may be needed. And then there have a picture that is talk about the finger jam. Next is the demo video that how to bandage a finger jam. For deep thigh bruise, treatment includes rest, ice, compression, and evaluation. Commercially available girdlers with tight pads are now available for protection. And then they have a picture that is talk about the deep thigh bruise. Next is the demo video that how to treat a deep thigh bruise.